Good afternoon, everyone. I'm Michelle Steele, Chairman of the Orange County Board of Supervisors. Thank you for joining us today. As we continue the fight to protect our community during the COVID-19 pandemic, our community has paid a heavy price. We cannot become numb to these losses. I, along with my colleagues, are doing everything in our power to keep our community healthy and safe, including making sure our healthcare system has the resources it needs for our residents. Additionally, as a result of state-mandated shutdowns, businesses and their workers took a devastating hit. Families are still struggling to put food on the table and pay their rent each month. It is heartbreaking to see all the hardships our community has endured. Amid these struggles, the people of Orange County have shown how strong they are. We are all working together to help our friends and neighbors as we work to return things to normal. Just yesterday, Rob Johnson, the mayor of Cypress, notified me that the city has allocated a total of $1.1 million of its CARES Act funding to 152 its small businesses. Every qualified business that applied is receiving support. That is a great news, and I look forward to hearing back from other cities in my district on their progress. Small businesses are the lifeblood of Orange County, and I cannot express how happy I am to hear that so many of these business owners will be able to keep their doors open because their financial assistance was distributed so quickly and efficiently. Because of this, not only do these small businesses now have the ability to keep their doors open, but their employees will be able to continue providing for themselves and their families. Now, I'd like to take a moment and explain how Orange County has been reporting its data and how we've identified an opportunity to further improve it. Every day, we all see COVID-related data from a variety of sources, and at some point, we question why the numbers don't always match. I met with the healthcare agency staff to better understand the discrepancies between the state and county data being reported at the local level. It is important to note this is not unique to Orange County, and in fact, other counties across the state face similar issues based on the time the data is downloaded from the state database. After county staff downloads the data from the state, they remove all duplicate cases and out-of-county residents and sort the cases by date of specimen collection, race, ethnicity, age group, city, and zip code. Because the county and community are interested in more accurate data, it takes time to go through these steps. During that time, the state continually receives updates to its database, which can lead to further discrepancies. In an effort to transparently share the most up-to-date information, I directed staff to identify a way to show the public the data reconciliation process on our website so everyone can see when the data is received directly from the state and how it is integrated to ensure accuracy and then analyzed. Transparency is the key because accurate data is the most powerful tool for policymakers. Next, I will go over today's COVID-19 numbers, and then I will address specifically what those numbers mean in terms of where we are as a county. The Orange County Healthcare Agency received 1,292 new cases of COVID-19 and 26 new deaths. Of these newly confirmed cases, 17 are from skilled nursing facilities, 5 are Orange County jail inmates, and 5 were homeless. Of these deaths today, 9 are from skilled nursing facilities and 17 were non-facility. This brings our total to 21,517 confirmed cases of COVID-19 and 402 deaths to date. 3,514 tests were reported today countywide, bringing our total number of those tested to 288,996. One thing to note is that these daily numbers do not indicate that the cases and deaths reported on a given day occurred all on that day. These numbers occur over a period of weeks and sometimes months, and are reported once test results come back. The lag is based on the time it takes labs to report to the state. You can find more information on where testing may be found on HCA's website at ocahealthinfo.com/COVID test. Here you can find over 50 locations countywide that conduct testing. I'm aware of the many issues that residents have had navigating the state clinic website, which is listed on the previously mentioned link. I want to let you know that there are many more county and private clinics for you to choose from Orange County Healthcare Agency's website. We have seen an increase in our trends of COVID-19 in Orange County over the past few weeks. The majority of deaths are in skilled nursing facilities, which are 50.5% of our COVID-19 related deaths as of today. We must continue to work closely with our most vulnerable populations. Orange County is home to some of the most well-equipped, best-trained, and highly experienced medical professionals who are working hard to ensure these populations receive the best available care. As of today, we have 691 hospitalizations and 236 in ICU. So what do these numbers mean? We want to deliver to our community accurate information about where Orange County stands when it comes to our coronavirus numbers. As required by the state, the testing positivity over a 7-day average with the 7-day lag stands at 14.3%. In terms of hospitalization, our percentage change in 3-day average COVID hospitalized patients stands at 9.6% below the 10% state threshold. Our percentage of currently available ICU beds stands at 36.9%. That is well above the 20% minimum requirement set by the state. Orange County also has 64.5% of ventilators currently available. That is well above the 25% minimum requirement set by the state. As of today, Orange County has 9,452 estimated recoveries, or 44% of total confirmed cases to date have recovered. Since our numbers are growing, I strongly urge the residents and visitors of Orange County to wear a face covering when you are in a public place and to practice social distancing as much as possible. Stopping the spread of virus will require following hygiene and social distancing guidance. The pandemic has impacted our daily lives in ways we could not have imagined just a few months ago. The responsibility for protecting public health is on each of us so that our friends and neighbors can safely and responsibly go to work. Each month, there are bills to pay and families to feed. We all need to do our part during these uncertain times so our community can go back to work and stay at work safely. Today, I am joined by Director of the Orange County Healthcare Agency and Acting Public Health Officer Dr. Clayton Chow and Deborah Bates, Director of Social Service Agencies. And again, I appreciate you all joining us today. And I'm going to bring Deborah Bates up here. Thank you.
Thank you, Chairwoman Steele. Again, this is Deborah Bates, Director of Orange County Social Services Agency. Today, I'd like to provide some critical updates involving social services efforts in support of the community during this pandemic. Today, we've entered the third week that some of our social services offices have reopened in what we're calling our Phase 1 reentry plan. We've opened 5 key regional centers during this Phase 1. Those centers are located in the cities of Aliso Viejo, Anaheim, Cypress, Garden Grove, Santa Ana. We are open with limited hours of operations, Monday through Friday from 9 a.m. to 3 p.m. We've utilized this phased-in approach in order to balance the need to mitigate the spread of the illness while ensuring access for critical services to our community. It also aims to control and limit in-lobby traffic to allow for safe social distancing. Visitors to our offices will encounter a variety of new processes. First, they will encounter a brief triage team. That team will review the individual's needs, assess for the appropriate response, conduct a short health care screening. During that triage process, visitors will also be educated on alternative methods of accessing our services in the event that they have future needs. Visitors will be asked to maintain appropriate social distancing and to wear face coverings. If they do not have a face coverings, we will provide them for them. We have rearranged our lobbies, taken precautions to modify our lobby seating configurations. We've installed protective barriers, and we're performing enhanced cleaning to help prevent the spread of the illness, among other safety measures. And all of our staff have been outfitted with the appropriate level of protective equipment. Key things that we want to remind everyone is once that visitor completes that first initial triage experience, if we have the ability to serve them immediately without them having to enter our offices, we're taking appropriate action, allowing that individual to go home. If there is a need for that individual to stay for further services, they're being warmly handed off to a lobby team. That lobby team's sole responsibility is to ensure that lobby capacity is maintained and that social distancing is occurring. Once the next step for our visitor would be meeting with eligibility staff. Those visits are being conducted through our lobby windows that are separated by glass barriers for further protection of our visiting staff as well as our staff. Again, we want to remind everyone that accessing to public assistance programs such as CalFresh, Medi-Cal, CalWorks, and General Relief do not require an in-person visit. Actions regarding applying for benefits, making appropriate case changes, asking questions about active cases, or just general eligibility questions can be mitigated through alternate forms of access. Primarily, we want you to stay safe. So know that there is no real need for you to come into our lobbies or into our offices, and know that the best way to access our services is through these alternate mechanisms of support. The first is our SSA call center, and just as a reminder, that number is 1-800-281-9799. In order to further support our community, we're going to maintain our extended hours of services for our call center. That call center operates Monday through Friday from 6:30 in the morning to 8 p.m. and Saturdays from 7 a.m. to 4:30 p.m. For those who have internet accessibility, The same services can be accessed through our online public portal, which are www.mybenefitscalwin.org. Again, we're here to serve. Couple of things that I want to share about our public assistance. The need in the community continues. Just to give you an idea, last week, between the week of June 29th through July 3rd, our contact center received over 17,300 calls, and we accepted over 4,600 applications for public assistance. CalFresh, due to food insecurities of our community, continues to be the #1 requested program. And just to give you an idea of that need, since March of 2020 through June of 2020, we've eligibilized over 26,000 new CalFresh households into our active cases. So we continue to process those cases as quickly as we can. Emergency benefits continue to be issued both on a daily both daily and through our specialized weekend drive-through services. Last week we issued over almost 400 emergency CalFresh benefits. But not just public assistance, just a reminder that we continue to be there for the protection of our children and our vulnerable senior populations. Our child abuse registry hotline continues to operate 24 hours a day, 7 days a week. If you believe a child is at risk of abuse or neglect, please call our child abuse registry at 1-800-207-4464. Additionally, if you believe that one of our aged or dependent adult populations is in need of support, or you believe that they may also be a victim or at risk of abuse or neglect, please call our APS hotline at 1-800-451-5155. But in addition to addressing the needs of public assistance needs of our community, addressing our protection services, the department has proactively been doing wellness checks across our most vulnerable populations. I will start with our CalWorks families. CalWorks are our low-income families with children household. In collaboration with various sectors of the social services department, my family self-sufficiency team, our CalWorks eligibility staff, have collaborated closely with our children and families child welfare division staff to conduct direct outreach calls to our CalWorks household beginning in April through the month of June. Those teams individually reached out to over 22,000 CalWorks households for the sole purpose of conducting checks on those families to determine if they needed additional support during these crisis times, and ensuring that any unmet need that family may have was filled. Calls generated referrals to additional public assistance programs, as well as other community supports and services, with the goal of ensuring that our families received the resources they needed for their health and well-being. But we didn't stop at our low-income families with children. We focused on our next most vulnerable population, which is our senior population and disabled adult. Through our in-home supportive services program, which is a program that provides in-home care and supportive services for elderly and disabled adults who are limited in their ability to care for themselves and cannot live at home safely without assistance. We began doing direct engagement and wellness checks to that population. Today, I can proudly say we're on our 6th round of those calls. We have identified 3,500 of the most critical in that critical population, and we continue to meet to address and check in to ensure that their ongoing needs are being met. Calls in this round are targeted to recipients who are most severely impaired and living alone, are 85 years or older, or have 200 or more authorized hours with an IHSS provider. But that wasn't enough. We know that today, when I call, there may not be a need. But tomorrow, when I don't call, there may be a need. And so we work diligently to establish a specialized hotline for those in-home supportive services recipients so that they would have a direct line to us in the event that a new need or an unanticipated need occurs tomorrow. We established an IHSS hotline for those recipients, and that phone number is 714-825-3000. Upon entering the call tree, selecting option 4, and that hotline operates Monday through Friday, 8 a.m. to 5 p.m. Last week, we received 72 calls from that vulnerable population requesting additional resources. That concludes Social Services Agency's update today. I'd like to pass it on to Dr. Clayton Chow, Healthcare Agency Director. Thank you.
Thank you, Chairwoman Steele and Ms. Bates. Good afternoon, everyone. I'm Dr. Clayton Chow, Healthcare Agency Director and Acting County Health Officer. The Orange County community as a whole is seeing a substantial increase in COVID-19 disease transmission. We identified our first case of COVID-19 on January 25th, and in the past few days, we have reported more than 16% of the total cases since the beginning of this pandemic. Over the past few weeks, we have seen our testing rate increase 69%, and the positivity rate increase in those tests from 6.6% to 14.9%. These trends are very concerning, and we can expect the impact on our healthcare system to get worse in the coming days and weeks. Increasing virus transmission leads to increasing hospitalizations. The hospital are actively preparing for a surge of patients and have done an excellent job to support the community in that regard. However, if the surge goes up to or beyond their capacity to mobilize resources, that causes a real constraint. A strain on the hospital systems means a strain on the ability to care for all patients, both COVID-19 and non-COVID-19 folks. For example, there could be a limitation in bed capacity and staffing resources, causing treatment of all conditions, including strokes and heart attacks, to be limited. This is ultimately harmful for the individual. So you've heard me say this again. Everyone in Orange County needs to help slow the virus. To protect our most vulnerable community, friends, family members, and neighbors, as well as our healthcare system from being overwhelmed. And you've heard me say over and over again, high-risk individuals, those 65 years and older, and individuals with underlying health condition, please, you should stay home as much as possible. Stay home if you're sick. Practice physical distancing. Wear a face covering when you are unable to physically distance. Wash your hands frequently. Avoid touching your face. Disinfect frequently. Touch surfaces often. We need all of us in our community to do our part. We have added a new individual and family tab on our website, www.ochealthinfo.com/novel coronavirus. That features downloadable information, prevention tips, testing recommendations, and instructions on how to care for someone who has been exposed to COVID-19. We are hoping that our community groups, faith organizations, and businesses will access the files and share with the community, share with your neighbor to help us spread the word about how to slow the spread of this disease. Thank you. So now I'm going to turn it over to CEO Kim.
Good afternoon. My name is Frank Kim. I'm the County Executive Officer. We'll now take questions from the media. Moderator, do we have any questions?
Yes, and ladies and gentlemen, as a reminder, if you wish to ask a question, please press 1, then 0 on your telephone keypad. You may withdraw your question at any time by repeating the 1-0 command. And if you are using a speakerphone, please pick up the handset before pressing the numbers. And if you can, please limit yourself to one question. For additional questions, You may get back into the queue, and we'll take additional questions as time permits. Our first question from the line of Tony Cabrera with ABC7. Please go ahead.
Hi, my question is about the reopening of downtown Disney today. Is this a positive step forward? They have plenty of health and safety guidelines in place, including a mask requirement for those 2 years and up, and temperature check that security. Do you think they're setting a good example to other businesses across Orange County as well?
I'll ask Dr. Chow to respond to that, but what I can share with you from my perspective is that Disney has done a truly outstanding job of keeping the county informed in terms of what their intentions were. So as they were planning for the reopening of downtown Disney, they had reached out to the county, invited us out. They have communicated not only to our healthcare agency, but also to the county executive office, implementing temperature checks, all the cleaning protocols. At least from a county executive perspective, I can share with you that all of the interactions that we've had with Disney have been outstanding, and they appear to be a fantastic example of how to open large-scale entertainment venues such as downtown Disney. I'm not sure if Dr. Chow has any additional comments. He's indicating no. Next question, please.
Thank you. We will go to the line of Alicia Robinson with the Orange County Register. Please go ahead.
Thank you. The Desert Sun had a story earlier this week that said San Bernardino County had to cancel people's appointments for COVID tests because of a shortage of testing supplies. Has this happened in Orange County, or do you expect it to happen in the near future? And what is the status of testing supplies available in the county? And then also anything else you can tell us about plans to expand access to testing in the immediate future?
Sure. I'll ask Dr. Chow to respond to that.
Hi, Alicia. Thank you for that questions. As far as we know, there is no shortage of testing reagents or necessary equipment to do testing in Orange County. We do know that there's a delay in getting tested because everybody is bombarded with folks who want it to be tested. This is a statewide issue, it's not just Orange County. As far as more testing site, we are working very hard in uploading access for our community. So that will be more to come. Thank you.
We'll go next to the line of Paul Anderson with City News Service. Please go ahead.
Hello. I wanted to ask about if your staff has determined a non-compliance rate for various businesses in the county in terms of following the state guidelines, for instance, restaurants.
Thank you for that. I think I'll ask Dr. Chow to respond to the specifics, but I am aware that we've had a number of complaints from residents in Orange County about businesses and restaurants that are out of compliance with the state industry guidance. The state had communicated with our county as well as other counties in California and provided their strike team in terms of access to members of the state ABC as well as to Cal OSHA. And so our county environmental health inspectors are working hand in hand with the state to ensure that all the businesses are operating safely and within the criteria established by the state. In terms of compliance rate, and I think that Dr. Chow may have more information on that. Thank you.
Thank you so much for that question, Paul. As Mr. Kim has mentioned earlier, before the preparing for the weekend of July 4th, the state has created a strike team, and but particularly in that strike team's representative from the Alcohol and Beverage Control Unit as well as Cal OSHA. And prior to July 4th, we were contacted by those representatives, and we had a very long conversation with those representatives, including my staff at the Environmental Health Services Department. And then after the July 4th weekend, I had a long conversation with our representative, particularly from the ABC, from the Alcohol and Beverage Control Unit. And to my pleasant surprise, they did visit businesses from several cities in Orange County over the July 4th weekend, and the number of compliance actually was very good. So I don't have the exact number, but they said that they found very few findings. So that's good news for us. But please be aware that they will continue to be in Orange County. Particularly, I know that this weekend they will continue to do so in visiting various areas in Orange County as well. But as Mr. Kim mentioned earlier, we work very closely with them. We have forwarded, per their request, the complaint from the community to specific businesses. We forwarded the list to them. So thank you.
To our next question from the line of Nick Gerda with Voice of OC. Please go ahead.
Hi, everyone. Thank you for taking questions again. I had two sets of questions. One is we're seeing a consistent sharp rise in hospitalizations. The daily hospitalization counts are going up by about 130 patients per week, now approaching almost 700 people in the hospital right now, about 4% of whom are from out of county. Wanted to get your understanding of what's happening in the hospitals right now, what your message is to the public about that. There was a county report yesterday calling on everyone to, quote, protect the hospitals by wearing masks and social distancing. Is that the county's message to the public? How do you plan on getting that message out to the public? And then secondly, on enforcement, curious kind of the process for how that now works. If bars or restaurants are in kind of obvious violation of health guidelines, like not requiring customers to wear masks. Previously, back in early May, the county health officer, Dr. Nicole Quick, was saying that county health inspectors do enforce the state health orders, and she was supported on that by other healthcare agency officials. But fast forward to a few days ago, there was that Huntington Beach restaurant. The answer on that from the county was that it's not up to environmental health inspectors at the local level to enforce it. So just curious kind of why there is that shift and what the enforcement process is, who people call if there is kind of egregious violations happening.
Thank you for that question. So I'll offer a few comments and responses, and I think there's an element in here that Dr. Chow can respond to in terms of what the role of the environmental health inspectors are in terms of enforcement of those health order guidelines and orders. In terms of what's happening within our hospital system, I think we've all seen the sharp rise in new cases. And we know that it can take a week or sometimes longer than that for individuals who are who've contracted COVID to have the severe symptoms that require hospitalization. So I think the concern that you're hearing from the county is that as we're seeing our daily COVID positive rates rise into the 1,000 or today even more than that, that those are individuals that may end up at a greater percentage within our hospital inpatient beds in the coming week or weeks. So I think that is the concern. So when you hear about the county asking individuals to wear their face coverings, to maintain their social distancing, to limit their interactions in high-risk activities, the reason why we do that is those are the very few tools that we have within the county to limit the spread of COVID-19. It is an airborne infection. We can get it by being in very close proximity and contact and limiting those kinds of high-risk interactions, whether they be within your own family environment or within your circle of friends or in transacting business or going to work. All of those kinds of opportunities present risks, some greater, some lower in risk, but they're all risky behaviors. And what we're asking individuals to do is, to the extent that they can, to reduce the number of those behaviors and contacts and activities so that we can reduce the overall infection rate that occurs within Orange County, thereby reducing hospitalizations. I think one of the concerns that I have is that one of the, I think, interesting or concerning dynamics that we've seen in terms of the positivity rate is that over the last several weeks where we've seen this rise in new infections, the younger population, the group that is 17 to 24 and 24 to 34, in that range, those numbers have gone up dramatically faster in the last several weeks than they have in the months leading up to where we are today. So what we're seeing is a significant and sharp rise in infection rate amongst our younger population. And I think the concern that we have is that, number one, the younger individuals seem to be expressed lower within our hospitalization rate, but obviously they have parents, uncles, and they're out in the community. So the real message that we have for our younger members of our Orange County community is to be safe and practice good hygiene. And if you're not feeling well, please stay at home and limit your contact so that we're not creating a burden on our hospital system by infecting those that are older or those that have underlying health conditions and creating the kind of concern and issues that I think we're all worried about within the next coming weeks. Because while today we may have adequate hospital bed capacity, we know that if these trends continue, we will be where many of our other county peers are at, which is at a situation where hospitals start moving into their surge planning and we start potentially having an impact on the number of beds that are available, not only for COVID patients, but for patients that require hospitalizations for other health conditions. With that, I'll ask Dr. Chow for any additional comments and also to comment about enforcement related to our environmental health inspectors.
Thank you, Mr. Kim. Hey, Nick. Thank you for your questions. Actually, I was going to say that I'm so impressed with Mr. Kim. He answered that question very well. You know, for those of you who in media, all of you in media, through your medium, if you don't mind, take this slide and really use it in your medium, newspaper or television or what have you. We need you to run this, at least in Orange County, perhaps statewide, but for Orange County, we need you to run this on a regular basis as a reminder, as a medium to really educate our community that this is really, really important. So in answering the question about restaurant, environmental health services only have authority to cite for food-related and food processing mistake or violations. We do not have the authority to cite as anything related to COVID-19. Just want to make that very clear. So the health officer can issue order related to COVID-19 based on the state California Department of Public Health being in line with the state order, but the enforcement is not our responsibility. It's more like it's not even our responsibility, it's not our authority to do so. So I want to make that very clear because there are people who confuse and how come environmental health not doing this and that. Again, environmental health authority is having to do with food preparedness and food processing. Okay, thank you, Nick.
Go to our next question from Brandon Bowe with Voice of OC. Your line is open.
Thank you for taking my question. Recently, the Orange County Sheriff clarified the department's mask order enforcement approach to say that education and voluntary compliance will be prioritized, but that enforcement will go beyond that for egregious violations, which up to the discretion of the deputy could range from a citation or fine up to arrest. Does the county feel that the messaging around the fact that enforcement around egregious violations, that citations and fines aren't off the table, should be stated more emphatically to encourage compliance for the public who, some members may not have had those educational interactions with law enforcement officers?
Well, thank you for that question. Now, I can't speak on behalf of our countywide elected sheriff, but I know that I have had conversations with the sheriff, and he does feel very strongly that it's important for us to be engaging the community to ensure that all of the good social distancing, mask wearing, appropriate practices are followed. So I think to follow up on your question, I think it would be appropriate for you to refer those questions directly to the sheriff's office. What I can share with you, because I think that we're getting a number of questions about enforcement, I don't want the community to believe that the county does not take enforcement seriously. That is not the correct message. What I want you all to understand is we absolutely believe in appropriate enforcement of social distancing protocols and other safety measures. So if my health inspectors, just because they don't have that legal authority, it does not mean that they're not working hand in hand with ABC or Cal OSHA or the state team in order to effect appropriate compliance within the orders that are issued by the state. Our staff care very deeply about this community and ensuring that our businesses are operating safely. So I don't want you to hear that mixed messaging. We are aligned with the state. We will do what is appropriate within our authority to effectuate compliance with the guidelines. Next question, please.
Go to Norberto Santana with the Voice of OC. The line is open.
Yes, thanks again, Frank and Clayton, for taking questions. It's always appreciated. I guess I'll just follow up on that one point there, Frank. If you guys are doing such a good job, why are the hospitalization rates going up? And I guess what I'm curious is, through your contact tracing and other types of work, do you have any sense as to what's happening? You know, we see that the numbers are higher in places like Anaheim, Santa Ana. The question being, do you have any conclusions yet about what you see happening? And also, I guess this question for Clayton Chow, the former health officer resigned before adjusting that mask order. You adjusted that mask order. Hospitalizations now are rising. Now you guys seem to be sounding a very different story on masking and be encouraging it very much so. Earlier, we had the sheriff himself say that he was not the mask police. So it seems like there's a lot of confusion about the messaging of how to take care of oneself in the community, what businesses to go to. You guys put something out on youth sports. That's something else I'm curious about. It seemed like the Board of Education had to send something out saying that state direction had changed on that before you guys put a message out. So again, I'm just curious about the messaging and what conclusions you've seen from the rising hospitalizations and whether you take any responsibility that these rising hospitalizations are because the messaging has not been very accurate or consistent. Thanks again.
No, I appreciate your question. I actually believe that the county has been very consistent in terms of our messaging. I think from the very beginning we have encouraged mask use. We have identified that social distancing, good hygiene, communication with the public about practicing all of those types of endeavors along with following the state guidance, those were limited. We told you from the beginning that we have very limited tools to control the spread of COVID. It has to do with hand washing, good hygiene, social distancing, limiting risky behavior, wearing masks, whether it's an order or a strong recommendation. The messaging, I believe, has been very, very consistent. I think one of the challenges that we have is that in a situation where there is a state-ordered lockdown or a stay-at-home type of order, I think it brings out, obviously, a lot of frustration and concern within the community because on any policy issue, you have a number of different stakeholders that may have different views or perceptions of it, and that is part of the public dialogue. And particularly in Orange County, where you have many differing views, I think that our board and the county has done a great job of providing a platform for individuals to engage with the policymakers and have those discussions. So I see that as a natural process and a natural order to what occurs when we're in a situation like a pandemic and there are very strong orders coming out, not either from the state or from our local health officer or business guidance that comes from the board. I think that we have been aligned and uniform in terms of how we've communicated that message. I guess I would disagree with you in terms of how that is framed. What I would say is that we have encouraged people to express their views, and that is part of what is I think wonderful about the way that Orange County has conducted this process. We've never closed our board meetings. We've encouraged people to attend, and we've been quite transparent. There's been plenty of opportunities where I think we haven't done as well as we would have wanted, and we have come out into the media. We've admitted any mistakes that we've made. To address your question related to youth sports, I actually was on the phone and I had a conversation with the Orange County Department of Education prior to them releasing that message and communication. So I can share with you that behind the scenes we've had ongoing dialogue with them. As you know, it was covered in the CBS News article that the state had modified their guidance in terms of whether youth sport drills and non-contact practices could occur. As you can imagine, when the state provides that guidance and authority to one particular county, all the health officers, all the county executive officers, we all speak to each other regularly. So many of us began opening that program that was consistent with the guidance that some counties had received directly from the state. And the state recently had modified their guidance on that, so we did the exact appropriate thing, which was we reissued the press release and we had conversations with the Department of Education so that they were aware. So I see this as being a completely open and transparent process, and which is why we're here every Thursday. So appreciate your question. Next question, please.
We'll go to Amy Taxon with the Associated Press. Please go ahead.
Thank you very much. I wanted to go back to the topic of the rising hospitalization numbers, and I wanted to ask if you could provide a bit more information about what the capacity looks like in the general hospital system outside of the ICU beds. I mean, the ICU capacity is posted daily, but there's 100-something COVID patients outside of that, and what does the capacity look like for those patients in the system, and how does that compare with any state targets? And also, if there's been any discussion of doing something like reducing elective surgeries or taking other measures to ensure there's adequate space.
Hi, this is Clayton Chow. Thank you for that question. In fact, this morning at the EOC, we have a call every week to talk about various issues related to COVID-19, and our emergency care staff who has a daily relationship and communication with the hospital told us that the rises in hospitalization is not just occurring only in Orange County. I want to make it very clear, just in case you have question. I mean, is rising in other county in California, and the governor made a very concerted effort in talking to the public as well as the health officer association have almost a daily conversation with our state representative on that very issue. In terms of Orange County, we have the report is that we have capacity, and that we are, even though we're in the high 600, close to 700, but our condition as it related to capacity for general hospital as well as the ICU is from fair to good. As chairwoman still gave you the number earlier, our percentage in terms of changes in 3 days in the hospital, we still below the 10% limit that the state has set out as is related to concern or not concern. And then also our capacity for ICU bed as well as ventilator is still quite good. So just want to share that with you. Of course, as the number rises, we have to be ready, and we have to be prepared. And there are hospitals who are talking about perhaps elective surgery or elective procedure would be on hold. We're not there yet, but possibly that will be the next step. So thank you for your question.
Will be from Matthew Leslie with the Fullerton Observer. Please go ahead.
Hi, good afternoon, everyone. Recent reports, including one from a Harvard infectious disease expert, suggest that air conditioning systems may be behind spiking levels of COVID-19 infections. Will the county take any actions to protect its own employees from possible airborne viruses in its own facilities? And does the county believe that the spread through AC systems is a danger to people? And will the county take any other actions to mitigate the spread of the virus through advising of closing of other businesses?
Well, thank you for that question. I don't know if Dr. Chow will have any additional comments, but I'll speak on behalf of county facilities. So what I can share with you is, number one, we have increased our cleaning frequency 25%. We hired an independent outside consultant to come in, review all of our cleaning practices, review the chemicals that we use to clean, the manner in which we clean, and the scope and space of cleaning that we conduct when we have a positive case. So that is in place. We also have implemented additional testing protocols so that if we have employees that are positive, that we have an ability to come out, look at those employees, quickly contact trace, and test the appropriate number of individuals. I think it's very difficult for us to turn off the air conditioners within our office buildings at a time when obviously it is the warm summer months, but I can assure you that we are maintaining appropriate social distancing. We have also encouraged our employees and my departments and department heads and managers to implement the continued practice of telecommuting, where the employees are productive and they're able to maintain their services to our customers. So we're doing a number of things across the board. We are reviewing our current pace of reopening public-facing offices, and likely you'll see us stagger those just a bit longer while we see what is happening with the infection rates. But I think you've seen us, as we've reopened public spaces, to do those in a phased approach. We are asking employees that come back and staff those facilities on a volunteer basis in many cases where we have capacity, so that we don't put individuals that may have other underlying health conditions at risk. I think we are doing a fantastic job, and I really commend the county managers and staff for really leaning in and really trying to provide an essential customer service during a time when it's very difficult to have operations remain open. So we understand the county is an essential business, and we are doing all we can to maintain that service and allow it to remain open during a time when there is some risk, right? But there has to be a balance between us providing services directly to our customers as well as ensuring that our employees and our workplaces are safe. And that's very difficult. As you imagine, the county is responsible for enrolling people into many of the safety net services that people that become dislodged from their employment would need, such as access to food services. That's our CalFresh program. So when you lose your job, you have difficulty funding your appropriate level of food for you and your family, and you also potentially lose your health care. And it's our social service workers, as Deborah Bates had pointed out earlier, that are at the front lines of qualifying our Orange County residents who may have been displaced from employment for access to Medi-Cal or CalFresh programs. So I see these as critical functions, and we're balancing that need. And that balance is not easy, and I commend the staff for doing a good job. I think we're getting very close to our time limit. Let's take one more question.
Yeah, that is from the line of Ian Wheeler with the Orange County Register. Please go ahead.
Thank you. I have a question on data transparency, and Chairwoman Steele sort of touched on this at the beginning of the conference. I had requested the raw data that is powering the HCA's COVID-19 dashboard, but was denied earlier this week because the data is apparently confidential and it contains personal health information. So I was told that the HCA is exploring options to make this data available to the public, and Chairwoman Steele mentioned that there would be better explanation on how the data is collected, et cetera. I was wondering if there were any specifics on the plan to make the raw data that powers these sites more transparent, available for downloads, explained a bit better, et cetera.
Hi, Ian.
And when that might happen.
Yeah, hi, Ian. Thank you so much for that questions. The reason why we couldn't share now is because the current new version 2.0 of our data, we couldn't download all the raw data onto that platform like we used to be. And so we are looking at other agencies within Orange County, within our county-wide family that have a platform where we can store the raw data, and we're in negotiation with that agency. And for the light of me now, I can't remember which agency it is, but we will make it available soon. What we'll do is every day when we do the analysis and put up the graph and put up the map on our current website, we will take that raw data, of course aggregated, not individual information, and then we will download it onto the other platform, and then we will share with you the link to the other platform so you can download the raw data. So I don't have the specific date on when that will happen in, but we're working on that right now. Okay? Thank you.
Thank you, everyone. That concludes our press conference for today, and we look forward to meeting with you next week again. Thank you.